Good evening, everyone, and I wish you a very happy Makar Sankranti. I'm Dr. Pooja Prasad, pursuing MD in Agatantra from Government Ayurveda Medical College, Patna. So, today, on behalf of Vedicus, I welcome you all in this webinar on the topic of Haldi and Ayurvedic concept of Deepan and Pachan in everyday's life. Talking about Vedicus, Vedicus was founded in 2015 as an initiative to bring trustworthy and beneficial knowledge of Ayurvedic healthcare system to the people, aiming to promote Vedic science like Ayurveda, yoga, naturopathy to all over the world. It has a group of it has a strong team of acharyas, Ayurveda acharyas, gurus, and healthcare professionals. Vedicus Foundation has also been organizing this education, health, and welfare programs. Especially, they have a concentration. They have given the a good concentration towards the children and women healthcare. So to begin the session, I would like Ofra ma'am to please introduce our today's speaker. Over to you, ma'am.
Well, thank you, Vedya Puja. Here we are actually like to call the people who have this much of knowledge Vedyas as part of being Vedikas. So we are very honored and very excited to have Dr. Nitin Rajan Kochar, which is a huge Vedya. As Dr. Kochar was saying in this slide, he is an honor consultant at K.E.M. Hospital in Mumbai and Health Center University of the University of Mumbai, an honorable consultant at K.G.M. Hospital in Mumbai, which is part of the very interesting thing that he's doing, because I think that part of being in this hospital, he can perform and he can understand many things that we don't see anywhere else. He is a very honored recipient of the prestigious Sandu Dhanwantari Award of 2015, and this is only what he wants you to know. He has many awards. He was the top of his class in Kayachikitsa. I think the whole University of Mumbai in Ayurveda, he was the top of his class. So Kayachikitsa, it's like, wow, how to shift this to revive people. He worked as investigator in Tata University and Medical Hospital and the Research Center about the efficacy and safety of curcumin and ashwagandha in osteosarcoma, which is a very interesting topic by itself. He has his own clinic and he's the scientific secretary of Gurgaon Mumbai Medical Association, which is like a very interesting area. He's practicing Ayurveda, nutrition, yoga, panchakarma, consulted at Gurgaon West Mumbai since 1995, so many years. And you can have his details, you can copy his phone number and everything. And thank you, Dr. Nitin. Please take your role so much.
Yeah, thank you. So, Afra and all, Dr. Pooja, I wish you all a happy Makar Sankaran. From today onward, we will see sun in the northern hemisphere. There is an end of autumn and starting of the spring. We will be more energetic. We'll have a lot of more festivals and a lot of good things to happen. So, first thing which I started for me today is to interact with you all intellectuals. Okay, so to start with, today I'm going to talk on Ayurveda concept of Deepan and Pachan and how to use this in day-to-day life with a special interest to Haldi. So, Afra and all, whenever we talk of Ayurveda, today what we see that a lot of people talk about Panchakarma. Panchakarma mainly massage and fermentation and basti and kati basti. Few people are doing vamana and virechana, but majorly it is massage and which are upakalpana, not actual panchakarma. Then a lot of people are doing good research on the herbal medicine. They are able to find out the active ingredient and see the efficacy. Yes, that is welcome. That is good. So herbal medicine, and actually it's a billion or trillion dollar industry in the world. So they find out, they take the material, they take the herb and they find out the properties of that and they use it clinical trials. This is all welcome. We are so Ayurveda is in 21st century is also alive and there is a different angle to look at it. It's a good sign. It's a very good sign. Also about the yoga, which is a part of, we pronounce it as a yoga, not as a yoga. Okay, so yoga is a part of Ayurveda, and definitely it has got a great impact on our health, social health, your psychological health, and your physical health also. But what is not being done is the research on the core subject, on the basic subject of Ayurveda. I know certain properties of the herb, say for example, black pepper or turmeric or Brahmi, and I have literature, modern literature, Western literature, that Brahmi is having memory enhancing qualities as written in Ayurveda. Okay, or ginger has got properties to digest, to improve the digestion and all. But if we don't use these herbs without applying the principles, Deepan Pachan principles of Ayurveda, there are heavy chances of failure. That's what my fear is. So one must do Panchakarma. If it is Deepan Pachan is not done, Panchakarma should not be done. Any Ashwagandha, Shatavari kind of things, herbs which are heavy for the digestion, if you give it, they will not be digested. You will not see the optimum result. On the contrary, you will see the side effects. So this link is, missing. And I know very soon people will realize this, and they will, researchers like you will come forward and will do research. So there is a great opening for the research on Deepan and Pachan. In our private practice, practically each and every Vaidya, it's not me, it's all Vaidyas, those who are having registered degree, they first do Deepan Pachan. So it's a basic treatment of Ayurveda. Okay, so let us understand that what is Deepan Pachan and its clinical application and how we can use it in our day-to-day life for betterment of ourselves. As I said, has got the great connection with India, probably as per the Megiddo Babylon civilization and Indus Sindhu Saraswati civilization. They are the almost 3,500 to 4,000 BC, and Israeli are the first foreign religion who settled in India. They assimilated like milk in the sugar without any persecution, without any controversies. They are staying in India and lovely people. Okay, so the bond is so long. It's almost 3,000 to 4,000 years before the Christ. We have got so many similar cultural things among us. This I already said as the Greenfield. Okay, so this will be my short outline of the topic, history of Ayurveda. I'm not going to be in a detail. It will be very brief. Then Ayurveda's unique foundation concept of Tridosha, then root cause of all the diseases and aging. What is Deepan Pachan? Its role in the treatment. Properties of turmeric and clinical application of Deepan Pachan and turmeric in day-to-day life. Those who are doctors, for them it would be a repetition. Those who are interested layman people, intellectual people, it will be something new probably. And I hope you all will like it. So as I said, Ayurveda is made up of two words. Ayur means life and Veda means no. In Jewish language, Ayur, life is called as a chayam. It's a bond of two people, two things. So a spirit, God spirit, and your own spirit. So it's a unity. Without this unity, there is no Ayur. The same thing Ayurveda says. And Veda, that is means knowledge. So in Israel, it is called Hokmah, if I'm correct in pronouncing it. Okay. So the science which tells you everything about life is called Ayurveda. And I'm not boasting, I'm not bragging by saying that Ayurveda is an eternal and perpetual science. We say Ayurveda is a eternal science. Why? First of all, it is not done by any human invention. It is existed. It is a modesty of Charak, Sushruta, and those who wrote for the betterment of the society without charging any royalty or without expecting any penny from the society. They just wrote it down. Okay, so it is existed since time immemorial. It describes and explains inherent things of the nature. And these natural manifestations are eternal. Plus, no experiments are done, no rat experiment, monkey experiments are done. It is experiential rather than experimental. Now, when I say it describes the inherent things, so let me give a simple example. So, banana is a fruit, it is sweet. Can anyone tell me that since when the sweetness of the banana existed? No one. Since the banana is there on this earth, it is sweet. The green pepper, black pepper, red pepper, they are pungent. The lemon is sour. Okay, so these are the things which are there in the nature. So our acharyas, Charaka, Vagbata, Sushruta, with their knowledge, with their yoga and meditation knowledge, they are able to understand, they are able to fathom this, and they have documented. They documented almost 1,000 to 600 years before the Christ, when all other part of the world they were not even knowing how to write or how to read. So this thing was documented. We have documented evidences. It was written down. Okay, and it said that it was existing and it was just written down 1,000 years before the Christ. So I am going to describe the things, whatever is eternal, it is existing. Turmeric is anti-inflammatory. Since when, we don't know. It has been there in the nature. It is its nature. Okay. So that's why Ayurveda is an eternal science and perpetual science. This is the Sanskrit shlok. I'm not going to have a lot of shlok. So, but this shlok, so I am Ayurveda Shashvato Nirdeshate Anadi Tatvat, time immemorial. So, Bhava Samsiddha Lakshanatvat. So, things are inherent things and Bhava Sabhava Nityatvat. And these things are going to be perpetual. Unless you get a genetically modified, GM modified some fruit. Okay, banana is going to be sweet. Okay, mango is going to be sweet. So on your right hand side, what you can see is a Charaka Muni, is a picture just not no one knows, but this is just thought of. And he has described more than 1,200 herbs. All the properties, inherent properties of the herbs has been described. And you all will agree today in the modern laboratories, we find exactly same properties of the herbs, not an iota of difference. If something they say it is anti-inflammatory, it is anti-inflammatory. Something it is analgesic, it is analgesic. So the same thing, how could they fathom it? We don't know. So Charaka has described 1,200 herbs. It has got a lot of diagnostic tools, how to treat, how to approach. All things are what is a good clinical practice, code of conduct for doctors, code of conduct for patients. Such a things are written in a minute and a great description. Recently, all over world, we all suffered the corona epidemic. So these kind of epidemics were described in Ayurveda, and how to recognize that epidemic is going to affect humanity, that is also being written. And they have directed that all Vaidyas, they should collect the medicines before this epidemic attacks you, so that you can treat. So this kind of epidemics are not new to India. They were there even thousands of years ago, and we knew how to treat them. And they were conducting public seminars for the health awareness. Like today, Vedicus and Ofra, you are conducting health awareness program. So at that time, they were conducting this kind of health awareness seminars also. This was the quality of education at that time of India. Sushruta had described, he is considered as a pioneer of this. Sushruta has described more than 300 different surgeries, including cataract surgeries, including cesarean section, which needle to be used where, which thread to be used where. So all these things are described nicely in the Sushruta. Almost 121 kinds of instruments, bronze instruments, to take the sterilization, how to pre-operative, post-operative, care to be taken of the patient, everything is written. Unfortunately, major part of that is lost because of the vandalism. Unfortunately, nothing could be done for that. We all are trying to restore our lost glory of that. Okay. So this is a brief history, as I said. Now, what are the main aims of Ayurveda? Is the first aim of Ayurveda is to nurture the health of a healthy person. Absence of disease doesn't mean that patient is healthy. You have to nurture health of a healthy person. So we say arogya. We don't say, the clinic. We say arogya kendra. We nurture the health of the person. And to treat the ill person in such a way that once he is restored to his health, he is able to do his all duties. The word used is dharma. Dharma here doesn't mean that Hindu, Muslim, Sikh, Isai. Dharma means duties. The duties, what the person is supposed to do as a father, as a mother, as a student, as a teacher, whatever his profession, that dharma he should be able to do. Dharma, artha, kama, moksha, these are the four duties of the person. So dharma is that artha, to earn money in an ethical way. Kama is it's non-restraint, I mean to say non-sexual promiscuous happiness, and then moksha is of course the salvation. So these are the four duties which every person has to do, and for that health is the main prerequisite, and that's why Ayurveda has been documented and written. Now coming to the basic, one of the basic principles, what we say that whatever existed, whatever is existing in universe, that is existing in your human body. So in human body there are space, that is ether, there are gases, okay, there is a fire element, there is a water, and these are the earth. So these are the five elements. So these are the five elements which form universe, and these are the five elements they form human body. So that's why there is a very strong connection between human body and the nature. So if something is gone wrong in the human body, you have to take care of the nature and correct that defect. If Akasha Tattva is defective, use some medicine which can correct Akasha Tattva. If fire element in the body is not working properly, use something which will improve the fire element, which will improve the fire element. So today's Deepan Pachan is mainly around the fire element, and that's what we are going to see. So this is the human body. We all know the thing, and everything has been written in Ayurveda. Also, the dissection written by Sushruta. All 7 layers of the skin are described. All organs are described. Everything. So when I read Ayurveda, so I get a human anatomy. I get a great connection between human body and mobile phone. So like mobile phone has got hardware, it has got software. So similarly, human body has got 7 structural tissues like rasa, blood, muscles, fatty tissue, bone marrow, reproduction. So they all form, all systems, all organs are formed. Okay, like hardware and software. But with this 7 structural tissue, or with this hardware and software, mobile is not functioning. You need something to function that. You need to move this tissue. You need to make these tissues work. So we have various apps. See, these are the so many functional apps are there in the mobile. So God has given us, nature has given us 3 important functional apps, functional units. They are called kapha, pitta, and vata. So from head to nip is a kapha predominant. From nipple to navel is a pitta, and from nipple down is a vata. Vata is always predominant. 80% is vata in the body, right? So these are the 3 functional apps in the body. They work. Vata is all your neuroendocrinological functions, your movement, your motility. Right now I'm talking to you. This is Vata. You are listening, your ear. Though there is a movement of my sound in your ear nerves. That is again because of the Vata. I'm moving my, the eyelids. That is Vata. I'm eating. I'm passing stool. I'm passing urine. So these are all Vata function. The joint movement is Vata. Pitta is digestion. It converts whatever you are eating to a bodily usable form with the help of Agni, which is residing in the Pitta. Okay, so Pitta is basically a transforming energy. It transforms. Vata is a kinetic energy. Pitta is a transforming energy. And Kapha is holding. Once something reaches to some point, it should be there for some time. It should not get vanished. It should not get withdrawn immediately. There should be some shape to that cell. There should be some strength. This strength, this shape, this holding is governed by kapha. So entire body is having kapha, pitta, vata. Predominantly, these are the areas. So head to nipple, if somebody is suffering, so your half part of the lung, half part of the heart, up to that, there is a kapha. Then half part of the lungs or half part of the heart to the navel area is pitta. So so Hridaya means heart and lungs. Basically, they get both kapha and pitta kind of disorder. Okay, and from navel down, it is predominantly vata. So your small intestine, last part, your transverse colon, and bladder and uterus, so all prostate, all these are mainly governed by Vata. So this is how these functional apps are working. Once the food is digested, body produces waste material, mainly fecal matter, urine, and the sweat, which are excreted and they are called waste material. So everything is important in human body. And what we say, the most important entity, like in the mobile phone, you have got a structural tissue, you have got a functional app, but if this battery is not there, what is the use? So there is something very important in our body is Agni, cellular biofire, or in a layman language, we can call it as a cellular powerhouse. It is the most important entity in the body. If Agni is not there, person is dead. That is what Ayurveda says. Shante agno mriyate. If Agni is doused, person dies. So Agni is most important entity in our body. Okay, like this battery. Am I clear, Afra? Is there a difficulty? Just let me know.
No,
Okay,
sir.
okay, great. So the what are the definition of the good health? So when these functional units Vata, Pitta, Kapha are in a harmony, all seven tissues are in their optimum health and proper excretion of waste material. Okay, with robust cellular fire. In Jewish language, cellular biofire or biofire is called Esha or Lehava. Okay, Lehava. So this cellular biofire, when it is robust, okay, it produces good amount of functional units. It produces optimum amount of seven tissues and it helps to excrete the waste properly. So this is the definition of good health in Ayurveda. So these are the pillars. These are the main pillars. Okay, from your Vat, Pitta, Kaph, Dosh, Dhatu, Mal, and Agni. These are the main foundation stones. Let us call foundation stones of the health. Foundation stone, they need some pillars on which your life can be, continued. So having a good diet, of course, exercise also. Sleep, most important thing. You should have 8 hours of nightly sleep. People don't sleep. They watch mobile, their laptop, and everything after 10 p.m., after 9 p.m., and then they say complaint there is no sleep. So melatonin level goes down, steroid level comes up, and there is no sleep. If there is no sleep, harmony of all units is affected. You correct the sleep and you see how the Pachan Dipan also improves. And of course, self-restraint, avoiding sexual promiscuity. Okay. So these are the three main pillars of your health. Foundation to the foundation stone. Harmony of all four units, Vat, Pitta, Kaph, Agni, okay, Dhatu and Mala. So if you have all these things in place, the person will have healthy longevity. If there is a defect, there will be a disease. A very simple thing, very simple thing. Okay. So you should have diet, exercise, sleep, self-restraint. Okay. Three dosh, dhatu, mala, agni. These are the four things. Now, what is Agni or cellular biofire or ash? What I said. Now we receive this Agni entity. As I said, today's topic is Deepan Pachan and it is more going to be on the fire element. So now I'm talking about fire element. So this fire element, I receive it only from my mother. We father do not have any role. Our sperms do not have this fire element. It is only mother who is giving me this. That's why I should worship my mother. We call Adi Shakti, right? So this Agni, Ash, ECH, is present all over the body. And every cell has got this Agni. It digests the food, converts body to usable form. It removes the toxins, all harmful entities, it is removed. It maintains, there is a beautiful shlok. I don't want to recite that, many people may not understand, but the meaning of that is that it maintains the vitality, strength, aura, skin complexion, body contour, your energetic youthfulness, and healthy longevity. आयु वर्ण स्वास्थ्य बल उत्साह उपचय प्रभा ओजो तेजो अग्नय देह अग्नि हेतु कहा. Sorry, I could not resist myself. So this is the effect of the good Agni. Okay, it will maintain vitality, strength, aura. So I don't need tonic. I don't need B complex. I don't need ashwagandha. I need something which will improve this Agni. This is the basic concept. People, in order to improve strength and vitality, consume tons of ashwagandha and shatavari and chawanprash and number of tonics. It doesn't work unless your Agni is good. It doesn't work. That's what we have to understand. Okay. If this Agni is vitiated, it will cause diseases. All the diseases, root cause of all the diseases. It's a dictum in Ayurveda. It's a dictum. Root cause of all the diseases is Agni. Either it's a poor Agni or vitiated Agni. Okay. Poor Agni is different, vitiated Agni is different. We will see. And if Agni is dead, that cell will die. And if Agni in all the cells, multiple, we have got 100 trillion cells. If the Agni in the cells die, okay, the person will die. So this is the basic important description of Agni. Okay. Now let us understand, do we have any kind of modern interpretation for that? It will be easy for all. Modern science is working fantastically to discover, rediscover human body and molecular biology. When I read about that entity, I said, yes, this is Agni, nothing but. So what I feel, the modern interpretation for the cellular biofire is nothing but mitochondria. If you read the description, it is written that if mitochondria, which is responsible for producing energy, producing for all raw material, if mitochondria is healthy, the cell is healthy. If mitochondria is dead, the cell is dead. So this is a healthy mitochondria. This is the damaged mitochondria which produces diseases, and this is the dead mitochondria. If this is dead mitochondria, the person dies. If you see, it is present every cell, 300 to 400. Every cell has got one nucleus, only one nucleus. But there are 300 to 400 mitochondria are there. So chances of getting mitochondria disease probability is more than the getting nucleus affected more first. Okay, so you have to protect this mitochondria, because this mitochondria, if it is vitiated, it will produce diseases. So these 300, 400 mitochondria are working in synergy. Whatever you are eating, whatever oxygen you are taking, ultimately it goes to these 200, 300 mitochondria. They digest the food, they produce the material of that cell. The bone mitochondria will produce bone, muscle mitochondria will produce muscle, fat mitochondria will produce fat, your thyroid mitochondria will produce thyroxine. Okay, so all these things, mitochondria work organ specific, cell specific. It is the center of metabolism. And what I've seen, we receive mitochondria only from mother. In the sperm, mitochondria are not there. They are there in the neck. So neck doesn't fertilize the ovum. It is the only sperm portion. So the sperm portion has got no mitochondria, because mitochondria generates heat. If that heat is generated, the sperm will die. And it is only present in the ovum. Ovum, the mother, the womb, the ovaries which produce ovum. So that ovum has got mitochondria. So we receive mitochondria from the X chromosome. Okay. Then it is responsible for converting food energy to cellular energy, as it is written, essential for the health, vitality. It is also written that if we are healthy, if mitochondria are healthy, and if mitochondria dies, we die. Now, as I said, Agni is vitiated by the wrong diet, not having proper lifestyle. Similarly, mitochondria is affected by wrong diet, free radical, environmental poison, stress, okay, and causes diseases. Agni is improved by fasting. Agni is improved by calorie restriction. Agni is improved by Deepan Pachan, mainly Deepan. So is mitochondria. So fasting, pungent, bitter medicine, it improves mitochondrial function. So I feel there is a close correlation between your mitochondria and Agni. Do you agree with me? Yeah. So mitochondria is your Agni. Okay. See, this is the mitochondria which consumes diet and oxygen, and it provides all energy. Mitochondria provides energy and the raw material to your brain, intestine, heart, your retina, your muscles, everywhere. You can see on the left hand, on your left hand side, the girl has got no wrinkles, nothing. This is a healthy mitochondria. And as the age advances or the number of mitochondria reduce in the cell, aged cell, it start wrinkling. So aura and everything, reduces as the mitochondria reduce. So you have to increase the mitochondria. Okay. See, this is the, again, what in Ayurveda says that Agni is the root cause of all diseases, written in Charaka, 1000 to 1500 before the Christ. This is a circulation research, June 2016, and many such journals are there. So mitochondria damage either because of the mutation or because of the stress or because of the environmental factors, pesticides and drugs and chemical and viruses, bacteria. So mitochondria dysfunction, it causes metabolic diseases like diabetes, obesity, cancer, abnormal inflammation and immunity, rheumatoid arthritis, SLE kind of things, aging, okay, degenerative diseases, and also cancer. Cancer, as I already said. So, pulmonary fibrosis, interstitial lung diseases, osteoarthritis. So, practically metabolic, inflammatory, degenerative, proliferative cancer, and all these kinds of diseases are produced because of the dysfunctional mitochondria. So, I say that Agni and mitochondria are same. If you improve Agni, your mitochondria is automatically going to improve. So, now I have got a target. When I say, I can explain it more confidently that I am giving medicine which is going to improve mitochondrial function, which is going to increase number of healthy mitochondria. Okay, let us see how. So wrong diet, wrong lifestyle reduces strength of Agni. What we say that Agni produces Ama when it is not working to the full optimum strength, it produces a toxic substance, Ama. So all inflammatory cytokines, all kinds of like uric acid, lactic acid, all other free radicals, all other inflammatory cytokines are produced in large because of the this can be considered as a ama, and this ama when circulates everywhere it causes disease. This is what Ayurveda theory is. So how to improve this biofire? One is direct, other one is indirect. So Deepan comes direct. If I give something which directly improves the flame, which directly amplifies the flame, which directly increases number of mitochondria, that is called Deepana. So this is called increase in biogenesis. And indirect. So I remove the obstruction over the mitochondria, the free radicals, the dosha or toxins, metabolic waste accumulated, the debris accumulated in the cell, they are not allowing the mitochondria to work properly. If I remove that, out of the cell, there is an interstitial space. There is again the inflammatory molecules are accumulated and they will not allow mitochondria to work and absorb. So if you remove that toxin, if you neutralize, that is called indirect way of helping mitochondria. So this is called Pachanam. Okay. So Pachanam is which will neutralize ama toxin. Your mitochondria starts working. You give Deepana, number of mitochondria increase. So this is what a simple thing I understood after 25 years of my practice. I'm a little slow learner, but I was thinking that why, what is Deepan and Pachan? So this is the simplest way I could understand myself, that Pachan is something going to improve, remove the obstruction around the mitochondria, around the cell. So your mitochondria quality improves. The function improves. The Krebs cycle, the electron transport chain, it improves. And direct means number of mitochondria are increasing. Instead of, or there are in a cell, there are 400 mitochondria, only 200 are working. So Deepan will increase other mitochondria to work. So that is Deepana. And Pachana, removing the obstructive pathology. Okay, we will discuss if you have any kind of doubt on this. Okay. So, what are the general symptoms of having good Deepan Pachan? Having hunger sensation at proper interval. In the morning, you get up, you get a good, no burping of the previously ate food. There is a proper hunger sensation. You pass the stool of the formed consistency, no smell, no odor in the farting. Okay. And no loose motion, no hard stool. You don't have to strain. There is no urgency. Timely making water means you are going to the urinate properly with no burning, no urgency, no odor, no discoloration. Many a time patient come to us and they say, doctor, whatever we ate, that taste is also there in the urine. That smell is there in the urine. So that is a bad sign of the or the poor digestion. Okay, having lightness and energetic feeling, you feel fresh, you feel there is no stiffness, no pain, absence of stiffness, pain. All your functionary organs are working properly. If so, these are the gross sign symptoms of Pachanam. When we talk about the diabetes and BP, if the Pachan Deepan is properly done, the BP, diabetes, all will be controlled with the minimum requirement of the drugs. Probably your requirement of the drug may reduce. That's why it is difficult in the elderly people to treat diabetes or the BP, because the stiffness has already increased. The obstruction has so much increased, mitochondria are less. So that's why they don't respond to the full optimum treatment. So that's why this Deepan Pachan treatment should be started at early age. At the age of 80, somebody comes to me to have Deepan Pachan, results will be not that encouraging. So from early age, Deepan Pachan treatment should be initiated. Okay, so this is what concept of Ayurveda is, Deepan Pachan. What are the direct ways to increase Agni? Exercise. Narohitahara vihara sevihi. Samikshakari visheshvasakta. I will control myself. So exercise. Do regular exercise. Okay, at least 30 minutes slow exercise. Even in such a chilled weather, I am doing swimming. So it is making me resistant. Okay. Yeah. Only 2 or 3 people are there in the swimming pool, my own swimming pool, our complex. So, but it is wonderful. Then controlled fasting, intermittent fasting, a big buzzword in today's life. We are saying, my guru, Dr. Devchand Gala, who taught me the fasting, he's MBBS and doing pure Ayurveda practice. He is now 75 plus. But then he taught me fasting in 90s. It will be wonderful, Ofra, if you keep his lecture. He's an ocean. He's an ocean of knowledge. You must keep his lecture. I request Dr. Pooja also. I will give the contact number. If it is possible for you, keep his lecture.
Yes, sir.
So controlled fasting or light diet, timely diet. Okay, then having some herbs like ginger, green tea, black pepper, mint, cloves, saffron, aspatida, pipali mula, chitraka, bhallaka. So there are 10 to 15 drugs, simple drugs are written in Charak 4th chapter. These are Deepaniya Gan, what we call. They increase biogenesis, they increase number of mitochondria, they increase activity of the mitochondria, they make carbonated mitochondria active. Okay, so these drugs improve intracellular processing. Now, in rheumatoid arthritis or in autoimmune disease, there is an abnormal processing. Body produces some abnormal protein which work like a new antigen, and autoimmunity is started. Unless you stop that abnormal processing, autoimmune diseases will not stop. So there is an enzyme which is found called PAD. Full form is peptidyl arginine deaminase. Peptidyl arginine deaminase. This PAD4 enzyme converts arginine to the citrulline. And because of this production of citrulline, rheumatoid arthritis and psoriasis, autoimmune diseases are started. So drug will be developed in the future which will be PAD4 inhibitor. This is what Ayurveda says. Whatever steroid and immune suppressant you give, unless and until you stop the production of abnormal protein, autoimmune diseases are not going to get cured. So probably in next 5 to 10 years, this PAD4 inhibitors, when it will be in the full force, you will have a longer remission in autoimmune diseases. Okay, so this is what a potential of Deepana drugs. Okay, they reduce abnormal production of protein, they improve electron transport chain functioning. In mitochondria there are Krebs cycle and etc which produces energy. So second thing, intracellular heat. Body, whatever food you consume, 50% heat is produced. Thermogenesis. A person like me can produce heat which can put a gallon of water, increase the temperature of gallon of water. So that much heat is produced. When mitochondria are not able to produce the heat, there is an accumulation of kapha, there is an accumulation of lipid, excess sugar in the cell. and that leads to insulin resistance. That leads to cholesterol formation. This is what Ayurveda says. So, deepener drugs, they improve intracellular thermogenesis. They increase lipolysis. They break down the fat, excess fat. So atherosclerotic diseases, all diabetes, you use deepener drugs. We will see how to use it in a day-to-day life. Okay. Am I reaching to you all? Is it difficult?
No, sir. No, sir.
No. Good. Afra, is it clear?
Very clear and very interesting.
Thank you. Thank you. Okay. So now Pachan, it removes the obstruction, as I said, over the mitochondria, which helps. The neutralization of ama and dosha is called Pachan. To expel the digested ama is called Panchakarma. If you do Panchakarma without neutralizing dosha, that will be very detrimental to the health of that person. So Pachana is a pivotal treatment, first treatment before doing Panchakarma. You do massage on the inflamed hand, the inflammation will increase. You give ghee oleation when the digestion is not proper, the disease will flare up. That ghee will not be able to digest mitochondria, they are not able to digest the ghee. So inflammatory molecules will increase. Okay. Then maintain the Agni and strength is called Rasayana. So discipline food intake, avoiding suppression of natural cause, very important. People have got habit to suppress the urge of passing stool and urine. They all produce some gases. Your intestine produces methane gas. There are incidences, there are anecdotal incidences which say that there was a blast during the surgery when the stomach was not cleaned properly and they used cautery, the intestine blast. So there's a methane gas is produced. So don't suppress this methane gas and other toxic gases which are produced by the food, non-digested food in the large intestine. They get absorbed in the your blood system and they cause a lot of other diseases. So don't suppress. Okay, the stool and basically urine. There are cases in which the sneezing was stiffened, the sneezing was suppressed, and the person develops cervical fracture because the air which is thrown from the lung is at a phenomenal speed. So don't suppress all these things. Have a lukewarm water, jeera, soft curry leaves. I will tell you how to improve the pachan. So now when we talk about the turmeric, okay, it's a bitter, the properties are bitter and pungent. It generates heat and dryness in the body. So excess consumption of turmeric will increase heat, will increase dryness. So you change what we call anupana. Give turmeric with ghee. Give turmeric with the milk. So dryness is reduced, heat is reduced, and absorption is improved. Okay. So generally I give turmeric with the food, or the formulations of curcumin what we use are lipidized formulation. Okay. It reduces kapha, pitta and ama. It is useful in anemia, acute and chronic wounds, diabetes, skin diseases, inflammation, insidious growth like we call apachi or arbuda, that is cancer, poison-induced diseases. Now, what is the meaning of poison-induced diseases? We don't consume poison. Poison-induced diseases are nothing but the allergic disorder. Allergy means something you react in an abnormal way. And there is a sudden vasodilatation, sudden hypotension, sudden sneezing starts, sudden urticaria starts. So these are all type 1 allergic reaction. They mimic your poisonous reaction. Somebody is taking B12 injection or penicillin, suddenly collapses. So these are all kind of, poisonous reactions. So turmeric is anti-poisonous. So it is very useful in all kinds of urticaria, allergic disorders like sneezing, asthma, bronchitis, the other diseases of the intestine. In that, turmeric is excellent. Also useful in the obesity because of the thermogenesis. Okay. Now this is the something research has been published that turmeric is useful in ischemic heart disease, stroke, Alzheimer. As it generates heat, thermogenesis generated, lipids are melted, and that's why it is useful in atherosclerosis. Okay. It is useful in cancer and diabetes. Okay. Let us see how. So, Afra may ask me, how come one curcumin or one turmeric is useful in so many diseases? I am, pulling out the mountain out of the mole. No, it is not like that. So, curcumin is useful in heart failure, cancer, chronic diseases, arthritis, diabetes because it acts on a very important molecule called nuclear factor kappa B, which is one of the very important factors for these diseases. That's why curcumin, there are other herbs also, but nuclear factor curcumin is a very potent anti-NF kappa B. So that's why curcumin is very useful in number of diseases. So many diseases curcumin is useful. Curcumin, these are the molecular target. Thanks to modern science, they found out what are the molecular targets of curcumin. So these are all factors which are responsible for cancer growth. They are suppressed. The factors which are responsible for cancer death, they are increased. You know, and the other factors also in which the curcumin acts. That's why it is useful in number of diseases. This is my paper published when I was in Tata Hospital. We have done study on curcumin efficacy on the osteosarcoma. May not discuss this, but just for the information. So this is published from American Heart Association International Stroke Conference 2011. After that also papers are published. They said that curcumin is useful in an acute stage of paralysis or stroke because it prevents the next stage of the stroke. If you give it, okay, it is quickly distributed in the brain and moderates several critical mechanisms which are involved in neuronal survival. That's why curcumin is excellent for the scientists must develop a formulation, and like you are giving ecosprin and clopidogrel, you should give something like curcumin and which can prevent the stroke. Considering the increasing age in the India and considering that in future we may be having a capital of paralysis in the in the world, we will be capital of paralytic patients. Number of patients of the paralysis will be largest in India. We all must consume turmeric. This will prevent, this will be a great contribution to the society. You are asking everyone to consume ecosprin, which is dangerous. I don't say, I don't deny, but at least start taking curcumin. Nothing wrong in that, right? So you can take this curcumin, which is going to prevent. Curcumin is also useful for this kind of neurodegenerative diseases. So many Alzheimer patient and dementia. Once the patient is having Alzheimer and dementia, it may not work that effectively, but it will prevent. Okay, so you start using curcumin from early age. Curcumin is excellent to prevent cataract. So these are the studies done and published in the journal. So this is the patient who received the rat received nanocurcumin. It didn't develop the cataract. All others they develop cataract. Okay. So this is the paper, the nanocurcumin result. It is done on the rat, of course. Now curcumin directly acts on the mitochondria. That's why it is very useful in cancer. I will just go through these journals. Many people ask me whether curcumin can be given with chemotherapy. Yes, it can be given. Paclitaxel. By the way, let me tell you, four of the best anti-cancer drugs: paclitaxel, camphotericin, vincristine, and poroflotaxel. These four drugs are derived from herbs from 2000, from 1960 to 2002, thanks to USA. National Institute of America, they have done a lot of research, and these four drugs, paclitaxel, camphotericin, podophylotoxin, and vinca alkaloids, they are all derived from the herbs. So herbs have got that much of the potential. So why not? The future is definitely curcumin and ashwagandha. And curcumin and paclitaxel, when you give together, the tumor bulking is reduced a lot. Okay. I'm also working on cannabis, and cannabis excellently makes cancer cells inactivate. It inactivates cancer cell. And when you give chemotherapy, so these cancer cells are washed out from the body immediately, and there are chances of relapse and recurrence are saved. Okay. So cannabis is also a wonderful drug which I am using. Curcumin improves the pro-apoptotic factors, means which kills cancer. Okay. So these are all curcumin related paper on the cancer. These are my patients in which not only curcumin I have used, but I have used Deepan Pachan. This lady, she was suffering from bad psoriasis, bad psoriasis. I have not treated such worst case. This I have treated 10 years ago. And she has taken steroids and everything. She had developed early age cataract by the age of 35. She had developed a cataract because of the steroid. So after giving her controlled fasting diet, okay, the turmeric and other Deepan Pachan drug first, she had taken Mahamanjeshwari Kada and Kaishor Gugul, nothing was working. So basically I understood her Prakriti, I gave her Pachan drug and you can see the difference. She is still in touch with me and there is no relapse. Sometime whenever she is in a stress, some rashes do come. I have not done Panchakarma. Because she had already done it. Okay. This is a non-healing ulcer. Frequent vasculitis. Lady, I think she is 65 plus. So Vata Kapha Shamak treatment was given. And she actually had maggots inside. And this is absolutely all right. Now this is also 4 to 5 years, I think. And there is nothing. This is a classical vasculitis. This patient came to me, 4 people held him and he came. And see, after the treatment, everything is gone. So main Deepan Pachan treatment are given. All these things were red. This is all gone. This is a psoriasis again. Young girl and was finding difficult to get marriage of a life partner because of the psoriasis. And she is absolutely fine. This is the worst acne I have treated. When he came to my clinic, at that time it is in the 2000. At that time I didn't have mobile phone, so these are all old cameras phone photographs. He had a very bad acne. They're smelling. They're all smelling. So after the treatment, it took almost 6 months. Only thing, there are some pores are there. The dark, I mean to say the pores didn't go. For that, and then I need to send him to the dermatologist for chemical peeling. Okay, otherwise his acne was totally treated. Deepan Pachan was the main treatment given to him. These are all my cancer patients. Number of cancer patients. I have more than 350 cancer patients, those who are on cannabis, and I got a data of almost 2000 patients of cannabis. So these are all cancer patients, various kind of cancer patients. They are receiving turmeric. In 2005-6, I was working in Tata Hospital, thanks to Dr. Manish Agarwal, who is a well-known orthopedic oncologist in India, and he got this trial done in Tata Hospital. Okay. Right now, he is in Nanavati Hospital. So these are the multiple myeloma cases. These are all various kind of cancer. They all are receiving turmeric. Many people are receiving cannabis also. Now, so these are my cases. Now, how to use Deepan Pachan in day-to-day life? So I will start with the brushing. Okay. At one hand, we say that microbiota is good for you. At other hand, we all use antibacterial toothpaste, which is killing your microbiota. I will show you the paper. Is mouthwash good? This paper, I am talking in front of international and national all esteemed doctors. That's why I have taken the pain to give you these references. In this, they found those who are using this. I'm not against any pharma. Okay, I don't have any interest. Okay, so this mouthwash containing chlorhexidine, they found that when you use this chlorhexidine, the nitric oxide level drops and the BP increases. You are killing your microbiota. Microbiota are the first thing, those who are doing Pachan for you. There are 100 trillion cells, friends, and 300 microbiota. Today, a great work is being done on the microbiota. These microbiota are doing the Pachan work for you. Deepan Pachan work they are doing for you. God has given you, you are born with those. And you are killing by having toothpaste first thing in the day. Okay, so increase use of chemical mouthwash, increase the blood pressure. I am not saying this, your paper is saying. 2019, Frontiers Cell Infect Microbiology 2019, PubMed indexed paper. Okay, so what I suggest to use fine powder of Triphala, neem, turmeric, salt, mango skin, bubble, licorice, meswak, etc. Please consult your doctor. Okay, and then only follow. Then don't suppress, as I discussed, your natural cause. This I already said. Then comes your diet. So these are the things which we are going to discuss. Answering nature's calls, exercise, bathing, tea, coffee, breakfast, lunch, snacks, what is to be taken, and how the Deepan Pachan will help. Okay, so to eat is a necessity, but to eat intelligently is an art. Okay, so my day starts with the tea. Morning time is according to Ayurveda is a kapha time, whatever may be the season, whatever may be the weather. Morning time when you get up, body it produces more kapha. The night time kapha is accumulated and that is produced. So you need to have diet which will break this kapha molecule. Excess kapha is bad. So freshly grated ginger, 1 to 2 pots of black pepper, cloves. Now this Arjuna powder, again, we Indians are prone to develop diabetes and blood pressure and heart attack, right? Drink Arjun tea. Arjun tea will make your heart blood vessels soft. The atherosclerosis will go. So you start your day with Arjun powder. We are taught to take ecosprin every day night, but ecosprin has got so many side effects. I don't deny, and please do not discontinue your ecosprin if you are taking it. But add on this Arjuna powder, and you see the result after 1 year. Okay, cardamom, cinnamon, good for diabetes. Tea powder, okay, water, milk or cream. Boil, filter and drink. Milk is essential because Arjuna will not get absorbed if you don't add milk or any cream, small amount of cream. You can also use coffee powder. No problem. The taste will not alter. Okay. So this is a healthy tea which will reduce your kapha, ama, and will improve the mitochondrial function. See, these are all paper cuttings. There are a number of research papers are there, but then I found compilation of this. For everything, whatever I am giving, there are research papers are there with me. So ginger can control the diabetes. Black pepper, which is a deepener drug. Okay. And of course, red pepper you eat in a moderation is good. Okay. Spicy curry is to a healthy heart. So you can have turmeric, black pepper, ginger made curry, and that is good. So my day is starting with the Arjuna. Okay, I am taking curry in the daytime and other things, other chutney and everything. I will show you. Jog every day. That will add. Today in India we have marathon. It was a fantastic event, and definitely it optimizes. But then start slowly. Many people die during running up. Do slowly. Don't jump. If you're a first time runner, just roll. That's it. Okay. You should maintain your heart rate, this, that, everything. You should properly follow your this thing. This is what Ayurveda writes. Those who are doing regular exercise, they can digest everything. See, this is written. There is no medicine other than Vyayama exercise which will reduce the fat, obesity. So only medicine is Vyayama. Okay. People purchase machine and then they do like this. Okay. So please don't do this. Okay. Then do meditation. There is no medicine which can make your brain bigger, but the meditation can do it. In the morning time, you must do thanksgiving to the nature, thanksgiving to the God. You woke up alive and, do some blessing, get the blessing and work for the people, elderly people. Your oxytocin level will increase when you when you help someone. When you help elderly, your oxytocin level, parental hormone increase, and that increases your immunity. Okay, help others to help yourself for the live longer. Okay, and don't have anger at your past life because that will kill you. Now this is something again from the I'm not again any Western diet, but this is what written in the current journal Allergy Asthma 2014. Okay, role of Western diet in inflammatory autoimmune disease. So outcome is Western diet increases insulin resistance, low grade inflammation, produces allergies, rheumatism, arthritis, heart diseases, cancer. And unfortunately, we Indians are slowly now moving to the Western diet. That is bad. Okay. The biscuits and cakes, if you calculate the biscuit turnover business in I think 25 to 50,000 crores. So much of biscuits. People say, yeah, in breakfast we take 4 biscuits in the morning, 4 biscuits in the evening. No, that is bad. Even the pregnant ladies, those who take biscuits, the cancer risk, the other autoimmune disease risk is increased in the fetus. That much of the bad impact of the maida bread, white bread, and the on the your body and the genes. Okay, people have a tendency to have a juice. No, juice is a kapha. It increases kapha. So don't increase juice in the morning. If you want to drink, drink in the afternoon. Okay, even unsweetened fruit juice can have cancer risk. So I'm not saying these are all British Medical Journal 2019 latest research. Okay, so what you should have for the breakfast? Calorie rich. What kapha shamak, agni vruddha, boiled eggs you can take, provided you have no burr, you pass stool properly. Feel that, and then you have the good breakfast. You can have pulses, boiled pulses. People take pulses in the evening. That is wrong. Pulses will produce more vata. So boiled pulses. Take dry fruits. Okay, dry fruits are nourishes, high protein. Okay, dry fruits also help to reduce kapha. Okay, they don't allow to increase vata also. Mixed grain dosa or green gram chila, what we call idli poha, not much fermented wheat porridge, wheat flakes. For God's sake, throw away cornflakes. They're bad, they're toxins. Okay, omelette, those who are eating. Chawanprash, if you have a good appetite, good hunger, pumpkin halwa, fruits, strictly avoid fruit juices. So you can make mix up of this and you can make a good breakfast of this according to your appetite and your country where you are staying and the weather. Okay, lunch. Lunch should be pitta shamak, nourishing. Majorly complex carbohydrate rich. So mixed grain again, rice or chapati you can have. Take fruity vegetables like gourd, all kinds of bottle gourd, snake gourd. You know, these kinds of gourds are pitta shamak, dudhi, pumpkin, ash gourd. They are all pitta shamak. Potato. Yes, you can take it in the afternoon. Brinjal, okra, green beans, peas. They are all pitta shamak. You can take it in the afternoon time. Have lots of curry and dal with the curcumin. Fish, chicken, you can have mutton. What if you are eating? I don't eat. I am a vegetarian. But if you can eat, you want. I eat paneer. So paneer, buttermilk, increase the microbiota. Add lots of turmeric in dal, vegetables, and curry. This is how you do. You are using the science in your day-to-day life. In the tea, I told you to have Arjuna, ginger. In the lunch, I'm asking you to have buttermilk, microbiota, have turmeric, rich dal and vegetables. Okay, pitta shamak vegetables. Dinner should be light. Vata shamak. People have full dinner. They have breakfast king size, lunch king size, and dinner also king size. That is wrong. Okay, so breakfast should be king light, the lunch should be driver, and the dinner should be like a beggar. Then you can have a breakfast like a king. But if you are having dinner like a king, please. And dinner should be some which should have a purgative like properties. Okay. So rice, green, moong dal, khichdi, add all kinds of condiments because in the night time vata increases. So you can add cardamom, cinnamon, jeera, ajwain, mint, everything you can add and make it tasty also. Okay. Dalia, wheat dalia, dal khichdi. You can have millet bhakri, jwari, bajri because they are full of fibers. So easy passing of the stool. These fibers, which are not digested by you own, they are digested by the microbiota in the large intestine. And they produce B12 and all other kinds of vitamins. That is good. Vegetable soup. Have chutney, curry leaves, coriander, and mint. Excellent for reducing vata, pitta, kapha, for having a smooth evacuation. Avoid pulses, avoid curd at night. So this is your dinner. Okay. Mouth freshener. Roasted fennel seeds 350 grams, triphala 160, turmeric, licorice. So you can make it and squeeze some lemon and just have it. This is fantastic mouth freshener Deepan Pachan. It's a wonderful in a taste also. Okay. Pickle. We all say don't eat pickle. I say eat pickle, eat this pickle. Fresh turmeric, fresh ginger, fresh avla, fresh carrot, or whatever you get. Just soak it, wash it properly in a hot water, slice small pieces, soak in the lemon juice, and add mustard seeds peeled. This pickle is healthy for the health, for the heart, for your lungs, reduces kapha pitta. This is excellent. Fasting once or twice a week. It will help you to live longer. Okay, it improves mood. This is from research in National Institute of America, February 2012. Shorter fast can give you longer life. Okay, do some once a week fasting. That is better for you. This was a trial done almost 25 years. The monkey on your this left hand side was given a calorie restricted diet. He survived war. Then the monkey who received full diet. Okay. Animals with highest calorie intake died earliest, and survival improved with the increased calorie restriction. Okay. There is no medicine which can actually increase the memory, but see, calorie restriction of fasting improves the gray matter. Meditation improves the gray matter. So fasting has such a important impact on the body. Now this is something panchakarma, that's okay. So it is easy. This is, sorry, a different slide. It is easy to kill cancer cells, but challenge is to keep the patients alive. So this is the diet what I tell patient. Now those who are in a slumber, please wake up. And if you have any questions, you can ask. I hope I'm in time. Yes, 1 hour.
Thank you, sir, for
Yes,
sharing the
yes.
valuable
Pooja,
information.
any questions?
Yeah, I would like from the participants. I think, ma'am, no one had asked any questions. I would like someone.
Okay, I have questions.
So either topic is understood or topic is not understood at all.
Yeah.
Topic is very much understood, but I have one question. Since I come from a place that they think that everything fresh is better,
Yeah.
what about like when you consume dry haldi as a powder, or you take turmeric like as a fresh? What is the difference?
Yeah.
Which is better and
So,
when?
so fresh fresh turmeric juice will always have a better effect. There are papers, those who are deriving curcumin from the fresh turmeric juice has got more potency. But it is difficult to get the fresh turmeric around the year. So the powder which is done, turmeric absorption will increase moment you add it to the fatty acid. Like you add milk, you ghee, it will increase the absorption. That is the simple funda. If you take turmeric plain with water, it will be not absorbed. It will work in the gut, it will go out. Biggest problem, the challenge in the turmeric is the absorption. And that can be solved by having some kind of fatty media. That's it.
Sir, I have a question. Sir, does
Yeah.
turmeric will act as a Deepan and Pachan? Like
Turmeric is an excellent pachan. If you look at the shlok, it's a ruksha ushna pachan.
yes, sir.
Tikta katuka, tikta katu, bitter and pungent. They are pachan. Basically, it's a pachan. Because of the ushna, you can call it a deepan, but because of the kashaya rasatmak, it is not that excellent deepan as ginger is. And when you give turmeric and avla together, so kashaya ras is reduced, and that's why it is useful in diabetic. The nisha amal ki yog, what we use. Yeah.
Good, sir. Thank you, sir. Sir, one of our participants have asked a question that in his family, someone has identified with a chronic pancreatitis, age 81. So, doctor advised him to give pancreatic enzymes. So, he's losing weight. So, what can be done? And
So
such.
yes, as I said, by that age, 80 age, it becomes all difficult to treat. Pancreatic enzyme, yes, patient has to take. There are papers, and I'm using it curcumin in a pancreatic cancer also, right? Now, in such case, chronic pancreatitis, basically he will need mostly a pitta shamak treatment. Mostly he will need a pitta shamak treatment. Turmeric may be useful. You can give turmeric along with licorice. Licorice is again pitta shamak drug. So if blood pressure and everything is under control, you can give formulation of triphala, turmeric and licorice. That will help him. Start slow. Yeah.
So there is one more question from my side.
Yeah.
Sir, how does this cellular biofire, you talked about Agni that comes from a
Yes.
mother. Sir, where we can find this the shlok, the reference
Ah.
from the Ayurvedic
So who has
herbs?
asked me? Let me know. Who has asked me?
Sir,
Who has asked this question?
I have this question.
So what is written in Ayurveda? What is written in Ayurveda? Shukram Saumyam. Shukram Saumyam. Artavam Ushnam. So what is it meaning?
Right, sir, I got the point. Thank you, sir. Thank
Yeah.
you so much
Yeah.
for
Yes.
sharing the valuable information with us. It's really
Thank you.
a very nice
Excuse me, sir.
presentation.
Yes, please.
If the Agni is inherited from the mother, is
Yes.
there any way we can improve it?
Yes, very nice question. That's why whenever, so that what we call preconception treatment, mother should have Garbha Sanskar, what we call. So before planning the conception, mother and father both should undergo this Deepan Pachan treatment if possible. Simple ways. Always you may not go for the Panchakarma. So simple Deepan Pachan, the ways which I have told you, this mother should do it for at least 3 months before conception. Once she is pregnant, she should avoid diet which are going to douse Agni. So all cold drinks. Many females they have a habit of drinking, coconut water, so that the born bachu will be a fairer color. But unfortunately, because of that, these bachus they kid develop a lot of cough and cold. So avoid diet which is going to douse the Agni. Okay. So if you take that proper care, then in pregnancy you should not take a lot of heaty thing. So avoid drug like Chitraka or Pipili Mula kind of thing, because it may be, detrimental to the health of the fetus. So in a small quantity, person can take turmeric slowly, solid, dissolved in the milk. You can take it. Okay, that is the best thing. In a small quantity, she can take the ginger powder. All condiments she can take. A sitopaladi powder, a wonderful drug for the cough and cold. So, which contains pepper, which contains cinnamon, which contains cardamom and vaushalochan and candy sugar. So, small quantity of sitopaladi, if she takes regularly, not more than 500 milligram every day, once, that's it, with honey or with simple ghee. So, that will, increase the agni of mother and the child both. Simple formulation. It is available, Sitopaladi. Or you can make it your own. Make it of the good quality Sitopaladi. In the market, they don't use candy sugar. They don't use the cardamom seed. They use
Bamboo.
entire cardamom. So use a good quality cardamom, good quality cinnamon, and make it.
Sir, what about adding turmeric to the tea in the morning?
Yeah, Arjuna powder can. Turmeric tea in the morning will not go. Turmeric, you can take it with the milk. You can take it with the milk. Or if
Bedtime,
you're
like
intolerant to milk, you can make the turmeric, boil it in the milk, make the curd, and then churn it and make a buttermilk and take it.
okay. Sir, thank you so much. It's been
Thank
a
you.
pleasure
Thank you.
having
Thank you
you.
so
It's
much.
amazing to hear you. And it's
Yeah.
encouraging each and every one of us to bring back health to home, to the kitchen, and act according.
Yes.
So thank
Yeah.
you so much to
Thank you
you
so
and
Thank you
all
very
our
much for
teachers.
the platform. Thank you very much. Let me know
We
in
hope
future if you need any queries to be answered. I will answer.
Thank you
we
so
would
much.
Okay.
like to have more lectures with you and
Yeah.
get wiser.
Sure, ma'am. Sure.
Thank you, sir.
Thank you, sir.
Thank you. Thank you. Bye bye.
And at last, I would like to thank Vedicus for
Thank you.
conducting such a good webinar and inviting Dr. Nitin Kochar, sir. We would we look forward to meet you again, sir. Thank you.
Yeah. Thank you. Thank you.
Thank you so much, sir.
Thanks to the all participants. And once again, happy Makar Sankranti to all.